back. You're watching NDTV 24/7 and we're bringing you the top developments in India's battle against coronavirus. India now has 873 cases that have tested positive till now. There are 149 cases that were reported in the last 24 hours. This is the biggest single-day jump till date in the country. The number of cured patients has also increased to 79. Kerala has reported its first COVID-19 death. Meanwhile, the numbers have also gone up in Jammu and Kashmir. Srinagar has the most number of cases. Meanwhile, the United States has announced a $2.9 million worth of aid for India. The government has also been giving daily updates continuously on how they are fighting the coronavirus pandemic.
कोमॉर्बिड कंडीशंस एक मेजर फैक्टर है, पर्टिकुलरली जितने भी हमारे पास केसेस रिपोर्ट हुए हैं, और उसमें इससे पहले भी बताया जा चुका है कार्डियक कंडीशन, हाइपरटेंशन, अस्थमा और डायबिटीज। ये उन केसेस में जिसमें इवन किडनी से रिलेटेड इश्यूज भी कई केसेस में पाए गए हैं, जिसमें हमें डेथ केसेस रिपोर्ट हुए हैं। देखिए, एज प्रोफाइल ये आप किसी भी स्टैब्लिश्ड, इवन जो हमारे रिपोर्ट्स भी आ रही हैं, वर्ल्ड ओवर भी आ रही हैं, एल्डरली पीपल आर एट ए हायर रिस्क। दिस इज व्हाट हैज बीन फाउंड।
रैंडम सैंपलिंग अभी करने की जरूरत नहीं है, क्योंकि हर सारी की सिंड्रोम की जो केस भर्ती होती है दवाखाने में, उसकी टेस्ट करने का इंडिकेशन हमने ऑलरेडी दे दिए हैं, तो उसको अलग से सर्वेलेंस करने की जरूरत नहीं।
We're doing continuous coverage on how India is fighting the coronavirus pandemic. We're now being joined by Dr. Neeraj Jain. He's the chairman of the Department of Chest Medicine at Sir Ganga Hospital in the national capital. We will also be joined by Dr. Rajesh Chawla, who's a pulmonologist at the Apollo Hospital on this program. Both of them are senior doctors and very, very good at what they do. So the questions have already come in. Let's first take a question coming in from Chennai. There's Rakesh Ori who has sent us a question.
Is Rakesh Ori. I am from Chennai. My question is, this lockdown is for the atypical symptoms and the normal symptoms for the COVID-19. I would like to know what are the atypical symptoms we should look out for in this case. Also, another thing we would like to clarify, the current hoarding and the out of stock of the hydrochloroquine tablets. Is there any basis for its common usage other than under doctor's prescription?
Doctor, before you answer that question, I'd like to add into that question, is there a vaccine against SARS that happened a few years ago? And Mr. Ori was asking about the atypical symptoms. So how is the presentation of COVID-19 different from the earlier SARS outbreak?
Do you want me to answer that?
Both, sir, yes.
Yeah. Basically, the symptoms of coronavirus, the current pandemic that we are seeing, are not different from any other flu that we normally see. Now, the atypical symptoms will be that some people will have no fever and they may have only a cold or a cough. They may have very mild symptoms. Now, I don't think this is the stage to talk about atypical presentations. You see, we are trying to get people to focus on the three primary symptoms that should prompt them to seek help or advice on whether they need testing or isolation or both. And I personally do not want to discuss any atypical symptoms. One, I don't think we have enough data on the current pandemic atypical symptoms. We are still collating data internationally, and we should not be propagating those symptoms in the, to the common public at large. The question of chloroquine. Now, hydroxychloroquine is an age-old drug that is very valuable for people with certain autoimmune conditions like systemic lupus erythematosus or SLE, rheumatoid arthritis. We use it in sarcoidosis, which affects the lungs very often. Now, there is no guideline which says that HCQS definitely works either as a prophylaxis or in treatment in combination with azithromycin or an antiviral or alone. The ICMR has very rightly issued guidelines saying if people are in direct contact with COVID patients, then yes, they can consider taking it as a prophylaxis, but it does not guarantee any protection, and they still have to take all the usual precautions that we've been advocating.
Right, sir. And how is the COVID-19 presentation different from the earlier SARS outbreak?
So I think the symptoms here are much milder. In most of the people, the symptoms are much milder. A larger number of people have been affected, but the symptoms are definitely milder compared to the earlier SARS epidemic. So I think that is the basic difference, but the symptoms remain the same. The degree of severity is different.
Right, so we have another question coming in from Bhopal. Mr. Atif Yar Khan gave us this question.
My name is Atif Yar Khan and I am from Bhopal, Madhya Pradesh. My question is that what should I do if I had a close contact with someone who is a confirmed case of COVID-19?
Right, so the same thing that you were saying earlier.
Yeah, so if you have come in close contact with a confirmed case of COVID-19, then the first thing you need to do is report to the nearest facility because you need to be tested and you need to be quarantined for 14 days. If you test positive, then in a facility that is equipped to deal with positive patients. If you're negative, then you still need to isolate yourself at home, very strict self-quarantine for 2 weeks. So there is no question of your delaying any advice on this. So you must go to the nearest center or your nearest physician who can help you and get yourself tested immediately.
Right, we have another question coming in from Raj Setia in Bangalore.
मैं राज सेठिया बेंगलोर से कोरोना वायरस कोविड-19 से बहुत ज़्यादा परेशान, बहुत ज़्यादा टेंशन में है हम सब और सारी दुनिया। इटली ने सरेंडर कर दिया, स्पेन बहुत ज़्यादा जूझ रहा है, यूएसए अभी तक हल नहीं निकाल पा रही है और अभी भी बहुत स्ट्रेस और टेंशन में है। हिंदुस्तान इतनी बड़ी आबादी, लॉकडाउन डिक्लेयर्ड, तो भी लोग बाग बाहर निकल रहे हैं, पुलिस सख्ती बरत रही है। अगर ये इमरजेंसी आती है तो क्या हम तैयार हैं? क्या हमारे पास इतने इमरजेंसी वार्ड हैं? क्या हमारे पास इतने वेंटिलेटर्स हैं कि हम इसको बचा सकें, हैंडल कर सकें? मैं ये जानना चाहता हूं कि हाउ मच आर वी प्रिपेयर्ड एंड आर वी रेडी फॉर हैंडलिंग द इमरजेंसी सिचुएशन?
So again, many questions being raised on how prepared states are.
Yeah. So let's understand one thing. India, because of the early action that it took, fortunately has not had the numbers to deal with that some of the other countries have had. And India is very proactive in preparing for the worst possible scenario. Now we have projected, if 10% of the population gets affected, how much do we need, how many beds do we need, how many ventilators we need. And I think the government is very active in procuring those. Right now, it cannot be overstressed. These people who are ignoring the precautions that have been told to them and the lockdown, the reasons for the lockdown should impose self-discipline. Please, none of us is immune to this. You can catch it in a very casual fashion. Please follow the precautions that have been told to you. And that is our best hope. Trust me, if this hits us in a big way, then we will be in very bad, in a very bad position. So please impose self-discipline. That is more important. But I think the gentleman can be assured that the government is definitely cognizant of the fact that this may become a major issue.
So there are many concerns, doctor, about people who have comorbidities and they are more prone to, being affected. We have a question coming in from Sheba from Chennai. Let's take that.
My name is Sheba and I'm from Chennai. My question is, what makes those with health issues like hypertension and heart disease have more complications when they contract coronavirus? And how are people getting cured? Has a cure been found yet? Thank you.
Right, so go ahead.
Okay, so I'll start with the last bit. In most patients who take precautions early and who are otherwise healthy, it's a self-limiting condition which cures itself. There is no medical treatment which will cure it so far in the world that is effective. Now, people with comorbidities, it is very important. I'm going to repeat a major list again. The elderly, people with chronic lung disease, people with diabetes and all its complications, people with kidney disease, heart disease, people on cancer chemotherapy, for example, or immune suppressants for any other condition. Their immune system is already weak.
Right.
Now, this virus will affect people in a very severe way where the immune system is not able to fight back. And it causes extensive damage in the lungs. And these are the people who will develop ARDS and maybe get onto an ICU and a ventilator. And that is the population that we are still not able to save in a large way. But most other people will recover provided they take absolute precautions and they take all the treatment for their underlying conditions also at the same time.
Right, we're getting some live callers now, sir. We're joined by Dr. Vijay Lakshmi from Puducherry. Go ahead, ma'am.
Yeah, sir, I just wanted to know that this is spreading actually across countries. So when the virus gets passaged from people, is it going to get severe day by day? Is the virulence going to get severe? Is it going to get virulent more powerful day by day? And one more important question is that, is it going to spread in a different fashion in different races also? Different races of people, because Mongoloids got affected initially, then Europeans is getting affected. Is it that Indians are going to get affected more severe or is going to be less?
Right, actually we're now joined by Dr. Rajesh Chawla from Apollo Hospital. Sir, would you like to take this question?
Yeah, please. It is difficult to say whether it will get more virulent. So far, they have not seen significant mutations.
Right, sir, I believe her question was that are we as Indians, depending, are different races, are going to be affected differently? Are Indians more prone to it or not? I think that was her question.
No, we are as prone as any other person. I was just hearing Dr. Neeraj Jain, that there are specific group of people who are more prone, and it has been seen all over the world. The data from our country is still not ready because we didn't have so many cases, but we are also finding, I'm managing now, and I'm finding the elderly, the patient with diabetic and cardiac, they are the one who are getting admitted in the ICU. So it is almost similar like any other place.
Right, doctor, we'll take another question coming in from Bengal.
Hi, this is Debalina. My question will be that till now all our efforts is concentrated on lockdown, isolation, which is basically preventive measures. But don't you think it is high time that we find some curative measures, or we concentrate our efforts on finding some cures? Because we understand that for a huge country like India, for a developing nation like India, prolonged lockdown is not a viable option. So, and we have a very rich history of medical research. So instead of waiting for some other country to find out a vaccine or a cure and then buying it with huge amount of money, isn't it time that our doctors should be encouraged to find out some cure for this coronavirus? Thank you.
Basically a question, the WHO has said that a vaccine is 12 to 18 months away, and definitely there is concern among people on what India is doing to develop its own vaccine or a cure for this.
So basically, I want to reassure the lady that not only India, the world over, there are scientists working day and night to develop an effective cure. Now, it's something that will take time. This is a new virus in some ways. You have to conduct enough, studies of, larger enough populations to really establish the efficacy or safety of a drug. There are anecdotal evidences already of triple therapy or double therapy that people have used for treatment, but the numbers are too small. And it is not that people are not working. So lockdown is still the most important way because you have to prevent spread.
Right.
Preventive aspects are still the most important. Once this becomes a calamity, dealing with it is going to be a nightmare, a disaster. So the lockdown should not be underemphasized. It is the most important thing for us right now, and please stick to it. Trust me, people are working all over the world for a cure as well as a vaccine, including India.
Right,
India
we're getting another caller, Dr. Ashwini Kumar from Hyderabad. Let's take his question and then you can continue, doctor.
Hello.
Yes.
Yes, please go ahead, Dr. Kumar.
Good evening, sir. I'm Dr. Ashwini Kumar from Hyderabad. I'm a dental surgeon. I would like to know, most of our patients and our dental fraternity people are really scared whether to go for a dental treatment and get a procedure done. And I would like to know regarding two things. One is, as a dentist, what precautionary measures and what patient has to, whether he has to be really worried, whether he has to undergo any emergency procedures.
Right, so, dentists work in an environment where they have aerosol exposure, and I think that is his concern.
Yeah, I think it is a problem. And if it is not an emergency, first of all, no procedure should be done because there is a direct droplet exposure. Even if the person talks, even that time you can have a droplet exposure. But if it is an emergency, then the treating doctor has to take care like we do in the COVID ward. He must wear the proper clothes, proper mask, only in emergency, and don't venture into any dental procedure till this settles down, because there is a risk, because you don't know which patient has been in exposure, particularly patient who has even a mild history of exposure. You should be extremely careful in doing any procedure.
Absolutely. We have another video caller coming in. This is a question coming in from Kerala.
I am Brigadier Suresh Nair, retired from Thiruvananthapuram, Kerala. My question is, given the number of corona affected persons in India and some nations of the African subcontinent are much lesser than those in Europe or the US, is there a probability that these countries, that is India and African nations, have or are still malaria endemic, and that a major part of the community have taken chloroquine or similar medicines as suppressive treatment for malaria? These people are less prone to corona infection. This question, especially in the background of chloroquine being accepted as a treatment for corona infection. Thank you.
Right, so this is on the same lines as the question that was asked earlier. I would like to take a phone call, a caller coming in, Dr. Wasim calling from Srinagar. Let's get that question for you.
Yeah, hello.
Yes, Dr. Wasim, go ahead.
Hello, this is Dr. Wasim from Srinagar.
Go ahead, sir.
Actually, I have a question. I am currently we are working in the COVID clinic, and currently we are facing a shortage of PPEs, and there is a problem that if you are provided PPE, that has got a lifespan of certain days or hours. But I just want to know that if we are given a mask or some protection gown, for how much time should it be used, and after how much time should it be discarded? This is my first question. My second question is regarding the virulence of the pathogen. That should we think of the good news that with the increase in the temperature and the humidity in India, should we think that the virus might lose its virulence in the coming months or days?
Right.
Should we keep...
Right, Dr. Jain, would you like to take that? You know, he's a frontline responder, and he's concerned about the shortage of the PPE equipment as well as the masks.
I just wanted to go back to Brigadier Nair's question. I think there's a very important correction in that, what he said. Hydroxychloroquine is not accepted as treatment so far. Please do not think that. He's made that statement that it's now that it's accepted as treatment. Yes, it's wishful thinking that Indians may have some immunity or herd immunity or genetic predisposition might be different, but I think that's wishful thinking. We would be foolish in believing that we are immune and that we can be careless. So I think that should not be propagated right now. Dr. Wasim's issue is genuine. PPEs are of different levels. You know, there are PPEs that are available which have to be discarded after 6 hours of use. And it's important that you have a proper mask or goggles. If you're working as a first lie in contact with potential COVID patients. And
Right,
a
sir.
gown,
I hate to interrupt you, sir, but I do want to slip in one last question, which I feel is very important. There's a lot of, for doctors like you, there's a lot of fake news also doing the rounds in terms of how to deal with coronavirus. There are all sorts of information going around, that you can kill it while it is staying in your throat for 3 days before it reaches your lungs. There's also fake news around how when temperatures go up, coronavirus will die. So just as doctors, Dr. Chawla, in fact, if you would like to just talk about what to believe and what not to believe.
There are a lot of myths going around, and every day there are a lot of fake news coming that, like the hot and humid, it will not occur. This is one of the things. And you hold the breath for 10 seconds. If you can hold, that means you don't have an active virus. And if you drink water, the virus which is staying in the throat will go in your stomach and will be killed. These are all wrong. These are all myths. Do not rely on anything which is being said, and probably one should rely only the government, what the government is saying, because they are the government, the Indian government, the WHO, whatever they are saying, I think believe that, rather than whatever the fake news you get on the on the social.
Right.
Please don't and just discard and don't forward it also.
Doctors, Dr. Jain and Dr. Chawla, I'm afraid we've run out of time, and as both the doctors were saying, believe the guidelines that have been put out by the Health Ministry and consult a doctor if you in case show any of the symptoms of COVID-19. That's all we have for you at the moment. News continues on the other side of the break.